causes bronchodilation by causing relaxation of the bronchial smooth muscles. So the autonomic muscles in the walls of the bronchioles are relaxed by sympathetic stimulation. If they're relaxed, that allows the lumen to dilate. So relaxation of the bronchial smooth muscle leads on to this situation where we have a large airway because the muscles in the wall of the airway are relaxed. If we go back up to the parasympathetic stimulation will cause contraction of the bronchial smooth muscle. So this will contract the bronchial smooth muscle. And if the bronchial smooth muscle contracts, then that's going to result in a small airway, which is the situation during an asthmatic attack. There is bronchoconstriction. So the sympathetic bronchodilates, the parasympathetic bronchoconstricts. In addition to that, it's parasympathetic stimulation which increases mucus secretions. So the secretions into the respiratory tract stimulated by parasympathetic activity. So I think you can see that the effects of asthma are produced primarily by parasympathetic activity, resulting in bronchoconstriction and increased mucus secretions. And this gives us two ways that we can treat asthma. What we want to do in asthma is to cause bronchodilation, and we want to reduce the mucus secretions. Therefore, if we can stimulate the parasympathetic receptors in the bronchial tree, then that will cause airway dilation, it will cause bronchodilation. If we actively inhibit the parasympathetic stimuli, then by inhibiting the parasympathetic nervous system, we will be inhibiting its contracting effect, we will be inhibiting its bronchoconstricting effect, therefore allowing the sympathetic to relax the bronchial tree. And in the same way, if we inhibit the parasympathetic innervation of the bronchial tree, we will inhibit the stimulation of mucus secretion, therefore we will reduce mucus secretion. And we'll see that most of the drugs used to actually treat asthma, as opposed to the drugs used to prevent it, but the ones used to treat it, normally are sympathetic stimulants or parasympathetic blocking agents. So that's the way it works in terms of the autonomic nervous system. Well, having looked at the pathophysiology, we'll now go on and look at the etiology. What is it that causes asthma in the first place? And there's two things we're going to look at to begin with. One is extrinsic factors, factors from outside the person, and the other is intrinsic factors, factors from within the person. And it seems to be a combination of these two factors that generate most asthmatic episodes. Because I suppose if you want to say what causes asthma really, an overall definition might be something like a hyper-responsiveness of the airway passages. They respond too vigorously to stimuli. And this gives rise to the idea of trigger factors, that there are certain factors which individuals can learn that trigger an attack. And that's very important to know about this, because they can then try to avoid these trigger factors. But let's now look through the etiology in some more detail, starting off with extrinsic etiologies. So in extrinsic asthma, there is a definite external cause that can be identified. For example, we know that triggering asthma off in the first place, why some people are prone to outside allergens and things, is related to maternal smoking. So maternal smoking is a major factor in children, especially young children who are exposed to the cigarette smoke of their parents. So it's very important as nurses that we advise mothers who are pregnant or thinking of becoming pregnant not to smoke when they are pregnant. And it's also very important, if they're carrying on smoking after pregnancy, that they smoke outside away from the children. Children have a right to breathe pure air, an air which is not contaminated by tobacco smoke. So that's one factor, early exposure to smoke. And early exposure to other allergens is also probably a factor. The children who are exposed to a lot of allergens early on in life may be more sensitive to those allergens. And an allergen is anything which starts off an allergic reaction. So in extrinsic asthma, there is an identifiable cause, and we'll look at some of these causes in a minute. The other overall classification of asthma is referred to as intrinsic asthma, or cryptogenic. Crypto means to do with cryptic, hidden. Genic means the beginning of. Cryptogenic means we don't know the cause, basically. It's idiopathic. And intrinsic asthma often starts in middle age, although not always, whereas intrinsic asthma often starts in childhood. But it makes no difference to the treatment, whether it's intrinsic or extrinsic. The clinical features are the same, the pathophysiology is the same, and the treatment is essentially the same. So as we've said, the common feature is airway hyperactivity. The airway responds too energetically to outside stimuli, causing bronchospasm, production of viscous secretions, and swelling of the surface mucosa. Now, some asthma is allergic in nature. Not all asthma, but very often asthma is allergic in nature. And things which are inhaled produce the release of histamine. So substances which are inhaled, pollutants or whatever, we'll look at some in a minute, cause the release of histamine. And histamine is a very powerful bronchoconstrictor. It's an inflammatory mediator. So in other words, allergens are inhaled, and this results in an inflammatory response. So what sort of things can we think about that may trigger this inflammatory response? Well, one is things that people come across at work during their occupation. So for example, bakers can become sensitive to flour. So occupational sensitizers. Animals are another cause, and insects, flowers and grains. And one thing that's occurred in the Western countries, and probably in developing countries, is people have become sensitive to the enzymes in biological washing powders in the places where they make biological washing powders. And platinum salts is another common cause in occupational asthma. Atmospheric pollution is a factor. Some people are sensitive to exhaust fumes from motor vehicles, which we've certainly got plenty of in our cities. But a cause you may come across is sensitivity to non-steroidal anti-inflammatory drugs. For example, aspirin can exacerbate attacks in some people. Aspirin-induced asthma to those that are sensitive to aspirin. Viral infections are another possible trigger factor. So someone might be fine in summer, then when they get a viral infection in wintertime, that triggers off their asthma. So clearly, people want to avoid these things. Avoid people who've got viral infections, keep themselves healthy to make their immune system work more efficiently, and possibly think about getting flu and influenza vaccination to prevent attacks. It's a bit complicated really, because some people's asthma is stimulated by the vaccination itself, but but sometimes it's very helpful to be vaccinated against the influenza viruses.